Always drained, your mood is a non-stop seesaw, and you can't concentrate on a task for more than 5 minutes? It's possible that you're facing attention deficit hyperactivity disorder, ADHD. But the ADHD diagnosis is much more complex than this. It can resemble other mental health conditions, and your symptoms might just be a result of a hectic pace of life. ADHD in adults often manifests as difficulty focusing, impulsivity, and mood swings. These symptoms can overlap with other mental health conditions like anxiety or depression, making a proper diagnosis essential. Adult ADHD diagnosis involves comprehensive evaluation, including medical history, questionnaires, and sometimes tests like EEG. It's important to consult a mental health professional for an accurate diagnosis. ADHD in adults can be classified into 3 subtypes: inattentive, hyperactive impulsive, and combined. Each subtype has distinct symptoms, and a person must exhibit at least 5 symptoms from one subtype for an extended time to be diagnosed. ADHD often coexists with other mental health disorders like depression, anxiety, and substance abuse, which further complicates its management. Treatment for ADHD in adults includes both medication and non-medical approaches like cognitive behavioral therapy, meditation, and regular physical activity. There are different opinions on what to call ADHD, a neurodevelopmental or a developmental disorder. Most of the time, they're used interchangeably and describe conditions that affect the central nervous system's motor skills, cognition, behavior, and communication. This group of disorders includes developmental learning disabilities like dyslexia, autism spectrum disorder, motor disorders like tics and coordination disorders, and ADHD. The cause of ADHD is still unknown. One established reason is the imbalance of neurotransmitters like dopamine, serotonin, and adrenaline. Another theory suggests abnormal brainwave patterns. ADHD affects executive functions, which are skills of the brain that allow us to achieve specific goals. These skills can and should be trained and refined for ADHD people to have a normal and successful life. Usually, ADHD is revealed before the age of 12 because it's a type of disorder people are born with. The first step toward an ADHD diagnosis is to visit a mental health professional or a medical practitioner. Doctors will guide you through the rest of your treatment journey and establish the right diagnosis. The process involves filling out a questionnaire, sitting an interview with a doctor, researching family and medical history, blood tests, and an EEG. For various reasons, a child might not have been diagnosed at an early age, so they grow up with the disorder and only as an adult question if how they feel and behave is normal. Lack of diagnosis and treatment leads to many adults developing depression, anxiety, and mood disorders, as they think they're lazy and not intelligent enough to cope with basic chores. Sometimes, adults develop separate ADHD symptoms, but that doesn't mean they have it. ADHD is a complex disorder influenced by many factors, and its diagnosis requires a deep medical evaluation. Most of the time, symptoms like anxiety or an inability to maintain focus are the result of excessive social media consumption or a stressful life, not ADHD. ADHD medical evaluation involves questionnaires and interviews based on criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. According to DSM-5, ADHD's intensity is subdivided into 3 levels: mild, moderate, and severe. It has 3 subtypes with core symptoms: inattentive, hyperactive impulsive, and combined. Primarily inattentive ADHD includes symptoms like making careless mistakes, difficulty concentrating, being easily sidetracked, poor time management, avoiding tasks requiring sustained mental effort, forgetfulness, and bad organizational skills. Impulsive hyperactive ADHD includes symptoms like fidgeting, walking and standing up when expected to remain seated, talking excessively, interrupting others, struggling to remain still, and intruding into other people's activities. Combined ADHD includes both impulsive hyperactive and inattentive symptoms. This type usually has a severe form and goes with other subordinate mental health conditions. To be diagnosed with ADHD, adults should have at least 5 symptoms from one subtype, symptoms affecting at least 2 spheres of their lives, onset of symptoms in childhood, and lack of any other conditions that would explain the symptoms better. ADHD has a high level of coexistence with other mental health problems, and untreated ADHD can cause a harmful clash with conditions like depression, anxiety, and substance abuse. Depression can co-occur with ADHD in up to 50% of cases, characterized by feeling unexplainably sad and hopeless for at least 2 weeks, and losing interest in activities that used to be fun and engaging. 50% of adults with ADHD suffer from anxiety disorders, which include panic attacks, phobias, social anxiety, and general anxiety. These can be successfully treated. Adults with ADHD face a higher risk for substance misuse. The study shows that 23% of young adults seeking treatment for drug abuse had ADHD. Doctors treat ADHD with various stimulants that mainly aim to increase the number of neurotransmitters in the brain. These include methylphenidate and amphetamine, known as Ritalin and Adderall. Natural treatments for ADHD include mindful meditations, cognitive behavioral therapy, CBT, and sports. These methods have been scientifically proven to reduce symptoms without harmful side effects. Adults with ADHD can have an absolutely normal life. The current environments are built for neurotypical people, but with adjustments and learning the art of living with ADHD, fewer symptoms will bother you. Thank you for watching. Remember, with the right strategies, ADHD can become your unique trait that helps you thrive. Stay tuned for more insights and tips.